Students, in this video we are going to discuss about immunostimulants. So previous class in the same unit we were discussed immunosuppressants. So the application of immunosuppressants is for treatment of to prevent and treatment of organ transplantation resistance. Second one is for treatment of various autoimmune disorders like rheumatoid arthritis, psoriasis, myasthenia gravis, lupus erythematosus syndrome, hemolytic anemia, so on. So, but today we are going to be discuss about in this video about a very small topic, that is immunostimulants. Immunostimulants are the drugs. Immunosuppressants suppress the immunity. Immunostimulants improve the or stimulate the immunity. That is enough. Immunostimulants are the drugs which stimulate the immune system either by increasing the cellular activity, cellular functions, cellular activities of the cellular activity of immunity cells, or increase the substance components of the immune system like various cytokines such as interferons, interleukins, and interferons, cytokines like cytokines like interleukins. Okay, so what is the use of immunosuppressants? Majorly used a condition suffering with immunosuppressive conditions. It is mainly used with immunosuppressive condition or the disease associated with immunosuppression. Okay, like for example, it is used in certain cancers. It is used in certain cancers and viral infections. Some viral infections are occur because of depression immunity, so can use better for the treatment of viral infections. Some fungal infections and AIDS, acquired immunodeficiency syndrome, and other autoimmune disorders. So these are the stimulant applications. So examples: levamisole, thalidomide, recombinant cytokines like interferons and interleukins 2, and vaccines. Okay, passive immunization and active immunizations. So active immunization nothing but administration of vaccines. They contain antigens which stimulate our body to produce more amount of specific antibodies. But passive immunization is a type of immunization used in the patient who are unable to produce its own sufficient antibodies. In such cases, you can administer specific antibodies, immunoglobulins, in particular conditions. Okay, but passive immunization is long lasting. Sorry, active immunization is long lasting, but passive immunization is slow acting. Okay, now we will discuss one by one. So first is levamisole or tetramycin. So levamisole is a levoisomer of tetramycin. So how tetramycin is going to be act as a immunostimulant activity? It actually by restore the functions of immunity cells. Okay, mainly reactivate the functions of immunity cells, especially B lymphocytes, T lymphocytes, monocytes, and macrophages. With this, there is a increase in phagocytic function of macrophages happening, and as well as the stimulation of the regulatory T cell is also going to be happen. Okay, so this is about mechanism of action of levamisole. So levamisole, it restore the activity of immunity functions, the cells involved in immunity functions. Example: B cells, T lymphocytes, monocytes, and macrophages. So along with it, stimulate the phagocytic function of macrophages. Okay, so use mainly used in certain cancers and as well as cancer, colon cancer, granulocytosis, and also used in Hodgkin's diseases. Adverse effects like flu-like syndrome, allergic manifestations, nausea and vomiting, because immunity is over now, so there is getting of antigen antibody reaction which goes to allergic reactions. Next, thalidomide. Thalidomide is a, already know that thalidomide strategy. Okay, it is used as a multiple it uses multiple conditions as an anxiolytic, as an antiemetic, or as an anti-inflammatory drug. Okay, so how thalidomide is going to be works? This thalidomide is going to be enhance uh, cytokines production from T cells. So it enhances the cytokine production from T cell. Okay, enhance the T cell productions like cytokines and cytokines like interleukins and interferon alpha. Okay, so and also cytotoxic activity of natural killer cells. NK cells means natural killer cells. Cytotoxicity against tumor mediated cells, so with this it is used as a immunostimulant activity uses. It is mainly used in myeloma. It is used in multiple myeloma and as well as dapsone induced nodus erythematosus. Okay, so dapsone induced sulfone syndrome. So in these two condition, this thalidomide can be used, but contraindication is pregnancy. Okay, because it is a teratogenic activity. Okay, next is uh, next is vaccines. Next is vaccine. One of the major vaccine is Bacillus calmette guarin is BCG vaccine. Generally, it is used as a vaccine for the treatment for prevention of getting tuberculosis. But other than this, it is also used as a immunostimulant. Okay, because it going to be activate the T lymphocytes function. Okay, it mainly activate the T lymphocytes function as well as macrophage functions. Okay, T lymphocytes function and macrophages functions. Okay, so because of this it is used as a immunostimulant effect. It is especially used in some tumors, example breast cancer, lung cancer. Okay, so like acute lymphocytic myelogenesis leukemia and all. So where it will improve the activity of the our immune system against cancer cells. Interferons. Interferons are the one of the glycoprotein cytokines produced by T lymphocytes in response to viral infections. In response to viral infections. Okay. So these interferons initiate the intracellular events which causes viral infections or go away. Okay. So like which stop the proliferation of viral infected cells. So by activation of by activation of phagocytic function of the macrophages and monocytes. Interferons mainly used for the treatment of viral infections. How they use in the viral infection means they activate the phagocytic, they promote the replication and activation of phagocytes. So especially these are used in some cancers like hairy cell leukemia, malignant cancers and melanomas, and caspocic sarcoma and chronic hepatitis B. So symptoms majorly these interferons are given by IV, so that it causes cardiovascular problem like hypertension or arrhythmia, CNS like depression and altered behavior, general infusion related problem like Malaysian headache. Okay. Next, interleukin 2. So interleukin 2 is one of the major cytokines produced from uh, the lymphocytes. Okay, so which generally responsible for activation and proliferation and differentiation of T lymphocytes. Then this interleukin 2 is mainly responsible for release of various number of other cytokines such as TNF, interleukin 1, interferon alpha by activation of T lymphocytes. Okay, first function of interleukin 2 is it activates the T lymphocytes, which leads to release of so many other cytokines. Second one is promote the proliferation and differentiation of T lymphocytes. So again, the problems of interleukin 2 is flu-like syndrome and other effects such as hypotension, drowsiness, confusion, loss of appetite. So this is about immunostimulants. One more thing is immunizations, active immunization and passive immunization. Active immunization means stimulation of immunity by giving antigen. Passive immunization means already the preformed antibodies are given into systemic circulations. So this is about immunostimulants. So example, thalidomide, levamisole, next interferons, interleukins. Okay, so on BCG vaccine.